Hello and welcome, everybody. We'll give it a minute or two to let everyone get logged in and join us. We'll get started here. We'll give it 2 minutes. We'll start at 12:02. I'm sorry, I realized I was just talking on mute. That's good. Hello, thank you all for joining our Childhood Vaccine Program Training Series. My name is Cheyenne Fontaine, and I'm the Vaccine Accountability Coordinator in the Office of Immunization. We're presenting today in webinar format, so please type your questions in the Q&A and we'll answer them at the end of the presentation. Today's training is being recorded and it will be posted to the CVP Training webpage after captioning is complete. So it'll probably be around the middle of next week, and we'll be sure to share that in the vaccine blurbs. All right, I'm going to turn off my camera now while I'm presenting and we can get started. Today we'll begin with a respiratory season update, including the new inventory and ordering requirements that are in effect. Then we'll cover COVID-19 vaccines and dig into storage and handling of the different COVID-19 products that are available to order this season. First, we want to give you an update on where we are at with ordering and shipping of respiratory products so far this season. As a reminder, we do have inventory and ordering controls in place this season to help reduce vaccine waste, so we can ensure the future stability of our universal vaccine program. First, inventory must now be completed in the IIS within the last 14 days for your order to be approved. Best practice is to complete inventory 1 to 2 days before ordering. You must use the recommended order quantity, or ROQ calculator, to order the right amount of vaccine or product based on doses used last year for the month you are ordering for. Looking at your historical administration data is key to smart ordering. All orders will be reviewed by your provider support specialist for accountability, the doses you used last year for the month ordering, and any other limitations. We will be adjusting orders as needed. This year, you need to choose one brand of COVID-19 vaccine to carry for each age range. And COVID-19 and flu vaccines are no longer exempt from tracking on the vaccine loss log. A vaccine loss log must now be submitted for all CVP products for any loss over $2,500 in 1 month. This allows our staff to more closely monitor vaccine loss. We are happy to report that as of last week, ordering has been turned on in the IIS for all respiratory products. For flu, we've been shipping vaccine for a few weeks now. Our allocation from the CDC can support daily flu order processing, and we will continue to process orders daily until the end of the flu season. For RSV, ordering opened last week, and orders were sent to the CDC on Friday. The first orders shipped at the beginning of this week, so they should be arriving in provider offices any day. Ordering is still limited as we have a lot of doses out in the field, including 900 doses of the 50 milligram product that will be expiring on October 31st. Providers must advertise if they have any of these doses unless they have eligible patients scheduled in the next 15 days. Any provider who could use 50 milligram product in the next 15 days should accept a transfer as soon as possible. Reach out to us and we can help facilitate a transfer. It is important that we utilize all the doses in an area before we will allow additional ordering of RSV vaccine. We ask you to promptly advertise any excess doses in the IIS so that they can be transferred to providers who will use them before they expire. For COVID-19 vaccines, the CDC opened COVID-19 ordering last week, and we immediately began processing orders. Orders dated October 7th to October 15th have already shipped, and some vaccine has already arrived in provider offices. The supply of COVID-19 will be limited at the start of the season, and reductions to orders may occur. Initially, respiratory orders are processed weekly, except flu, which I mentioned has already switched to daily order processing. We will move to more frequent processing as soon as possible. It just depends on our allocations from the CDC. To help you know when to order, I've indicated the days of the week that orders are processed for each product. That's in the far right column. You should allow for at least 3 days for order approval from the time of your submission. This allows us to complete all of our accountability checks. Orders need to be in pending state approval status in the IIS by close of business the weekday before the processing day to be eligible for an allocation that week. Orders will be pulled from the IIS at 8 a.m. on the days listed in the far right column and checked against the allocation that we have available from the CDC. To help with planning, remember that shipping for COVID-19 and RSV can take up to 2 weeks from the IIS approval date for you to receive your shipment. Under the CDC contract, McKesson and Pfizer have 2 weeks to deliver to provider offices. For flu vaccine, the CDC has contracted with McKesson to treat our flu orders as a priority, so the processing and shipping of flu orders is typically within 2 days of McKesson receiving the order. Remember, we have a flexible ordering schedule for respiratory products. You're welcome to place orders whenever you are running low. You don't need to wait until your monthly ordering window. All right, flu ordering. So just a few notes on flu vaccine. We have plenty of product in our allocation, and we aren't reducing orders at this time if you are ordering based on the amount of vaccine you administered for the same time last year. We know many providers plan flu clinics right now, and we want to make sure you have the vaccines you need while demand is high. As demand begins to drop off in January, we may begin to reduce orders to avoid excessive waste. I've included a link here for the flu vaccines at a glance document to show you all the products that are available to order. For ordering of RSV, we will start with nirsevimab and clesrovimab. These are both monoclonal antibody products. Nirsevimab can be ordered in a minimum quantity of 5 doses. The 50 milligram nirsevimab product for babies up to 11 pounds will be prioritized for birthing hospitals and limited to minimum amounts for other providers. Merck's new clesrovimab will be available to order beginning in December in a minimum order quantity of 1 dose. It does have a longer shelf life than nirsevimab, which might make it a more practical choice for smaller providers that don't frequently administer RSV products. If you choose to change RSV product when clesrovimab becomes available, no orders will be approved for the new product until your existing nirsevimab product is at a 2-week supply. At this time, we are not requiring or recommending that providers keep RSV products in their inventories if it is not routinely administered. As a reminder, we will review all orders against the regional RSV inventory to ensure that providers utilize all doses in that region through transfer before allowing additional orders for this product in the IIS. There are ordering caps in place for RSV this season. Orders will be approved based on half the doses used for the same month last year. We will be denying orders if you already have a 30-day supply of product on hand. We want you to use up most of your existing stock before placing a new order. There is plenty of product out there, so there is no need to stockpile at the beginning of the season. Orders will be denied if there is excess product in your region that can be transferred. Please check the vaccine advertisements in the IIS before you place an order. For new providers, or if no previous administration data is available, the order will be capped at 50 doses. This is for all products. The table here shows the ordering caps that are in place for nirsevimab. If you find that you are using more than the cap, you can place an additional order during the month. Abrysvo is the RSV vaccine. It is available by special order for pregnant adolescents under 19 years of age from 32 to 36 weeks of pregnancy. It can be administered between now and January 31st. You can order this vaccine in quantities of one by special order only if you have an eligible patient. Please do not order just to have the vaccine on hand. You can email us if you need this vaccine for an eligible patient, and we will place the order for you. Please allow 3 weeks for order processing and shipping. Now for COVID-19. Initially, COVID-19 orders will be approved for up to 50% of the doses administered in the same month last year. This is due to the limited funding we have available to start the season, and this will change as the season progresses. You will need to place smaller, more frequent orders, and we ask that you only order when you need more product. You don't need to stockpile vaccine. For new providers, or if no previous administration data is available, orders will be capped at 50 doses maximum for the order, and this includes all presentations of the vaccine. As demand begins to drop off in January, we may begin reducing orders to avoid excessive waste. This year, you must select only one product to carry for every age range. All vaccines will appear in your order set, but please only select one brand for each age range. If we get an order with multiple brands, it will be denied. And just a reminder that all CVP providers are required to carry and offer COVID-19 vaccines for the population they serve. We expect all providers to have COVID-19 vaccine available to ensure access to vaccines at no or low cost. This is especially important in rural areas where healthcare access is limited. If children are referred to a pharmacy or another facility that is not enrolled in the childhood vaccine program for routine or seasonal vaccines, parents may be charged for the vaccine and administration fees, particularly for uninsured children or those enrolled in Medicaid. If there is not enough vaccine or products in our allocations from the CDC, orders will be reduced based on our equity framework and the allocation percentage that we received. I've included a link to the equity framework here for your reference. All right, let's do a knowledge check. All right, so you must order vaccines/products based on A, the number of doses you ordered last month, B, the number of doses you administered last month, C, the number of doses used last year for the same month you are ordering for, or D, none of the above. All right, looks like most of you got it correct. The right answer is C. You must order vaccine based on the doses used last year for the month you are ordering for. Nice job. All right, now we'll move on to COVID-19 vaccines. On August 27th, the FDA authorized updated 2025 to 26 COVID-19 vaccines. Please note that Moderna's mNEX spike was approved by the FDA, but it is not available to order through the childhood vaccine program. The FDA's guidance in this table is not in alignment with Department of Health's September 4th COVID-19 vaccine standing order. The Washington State Department of Health does not expect to change its current COVID-19 vaccine recommendations that are outlined here unless new science shows a clear reason to do so. We're going to continue to follow guidance from the American Academy of Pediatrics, the American College of Obstetricians and Gynecologists, and the American Academy of Family Physicians. The Department of Health's COVID-19 vaccine standing order authorizes healthcare providers to administer the most updated versions of the COVID-19 vaccines listed here to all persons 6 months of age and older, including pregnant individuals. It is intended for individuals to receive COVID-19 vaccine off-label when guidance differs from federal guidance. got a link here to the COVID-19 standing order. I've also included links to additional COVID-19 standing order resources, including answers to frequently asked questions for both healthcare providers and the general public. The FDA revoked the Emergency Use Authorization, or EUA, for Novavax, Moderna, and Pfizer COVID-19 vaccine on August 27th. If you still have 2024, 2025 COVID-19 products in your storage units, you should remove them immediately, even if they are not expired. Please don't discard these vaccines. They must be returned, which we'll cover on the next slide. So for children 6 months to 11 years, vaccines with revoked EUAs must no longer be administered. If you have administered any of these products on or after August 27th, it is considered a vaccine administration error. For ages 12 years and up, these products have been delisted effective August 27th by Moderna and Pfizer. Please stop administering the 2024 to 2025 vaccines. Please reach out to us via email if you need assistance, especially if you have identified an administration error. Our storage and handling team is available to help. It's important that you return all expired and spoiled COVID-19 vaccine. Our program receives an excise tax credit on these returns, which helps offset a portion of the loss. The first step in the return process is to reconcile your 24-25 COVID-19 vaccine inventory in the IIS by categorizing the vaccines as spoiled with the reason noted as expired BUD. I've included a screenshot here of what that looks like in the IIS. Please do not use the category recall. Then submit your return in the IIS before you inactivate the vaccine lot number. Our returns guide that is linked here will walk you through the returns process and show you how to get a return shipping label. As I mentioned earlier, you will need to submit a vaccine loss log for any COVID-19 vaccine loss over $2,500 in 1 month. This will allow our program to more closely monitor COVID-19 vaccine loss. Now we'll touch on the different storage and handling requirements for the COVID-19 vaccines. This COVID-19 vaccines at a glance chart shows all the publicly supplied COVID-19 vaccines that are available to order. This helpful document also details the storage and handling requirements for each product. It's important that you consider the type of storage units you have before choosing which product and the quantity to order. If you are using an ultra cold unit to store vaccines, the probe on the digital data logger, or DDL, needs to be an ultra cold air probe, or a probe designed specifically for ultra cold temperatures. The probes for regular refrigerators and freezers should not be used. We also have a separate temperature log for ultra cold storage units, which I've included here in Fahrenheit and Celsius. If temperatures go out of range and you have a temperature excursion with COVID-19 vaccine, you should follow the same steps you would for any other vaccine by following our temperature excursion guide. To meet your reporting requirements for a temperature excursion, you can document details through your REDCap portal. Best practice is to submit this information immediately after the excursion occurs. It is best not to wait until you submit your monthly temperature logs. Immediate temperature excursion reporting will be required after January 1st, 2026. If for some reason manufacturer guidance is unclear as to whether you can continue to use the vaccine, please contact the Department of Health. They may say something like, "It is up to your discretion whether you want to continue using the vaccine." Because this is publicly purchased vaccine, providers do not have the authority to discard vaccines. That is a call that the Department of Health will make, so please reach out. And if you need assistance with your temperature excursion, email us at the Childhood Vaccine Program, and we can connect you with our storage and handling team. What is a beyond use date? It is important that you know when to use a beyond use date, or BUD, for COVID-19 vaccines. A beyond use date replaces the manufacturer's expiration date and should be noted on the label along with the initials of the person making the calculation. The CDC has BUD labels, but any method is acceptable. It is important that you do not use vaccine after the beyond use date or expiration date, whichever comes first. Whenever you move COVID-19 vaccine from ultra cold storage or a standard freezer to the refrigerator or to room temperature, you will need to record a BUD on the box or vial. We have been seeing issues during site visits where providers have forgotten to note BUD dates on vaccines, and some of these situations have resulted in the need to revaccinate patients. I've got links here to CDC BUD labels and 2 helpful CDC trainings on this topic. It's important that you don't ever change the expiration date for COVID-19 vaccine to the beyond use date in the IIS. When a vaccine is passed to the beyond use date, you will need to adjust the vaccine from your inventory in the IIS. You do this the same way that you documented your returned 24-25 COVID-19 vaccine. When COVID-19 vaccine has an expired BUD, remove the vaccine from your storage unit and adjust the doses out of your inventory using the category spoiled and the reason as expired BUD. After reconciliation, you should follow the vaccine return process that I've linked to here. All COVID-19 vaccine loss, expired, spoiled, and wasted must be accounted for in the IIS, and all expired and spoiled vaccine must be returned, except for punctured multi-dose vials. All right, now let's jump into the publicly supplied vaccines available for 2025 to 2026 and their specific storage and handling requirements. Here are the COVID-19 vaccines that will be available to order through the Childhood Vaccine Program. All these vaccines are available to order in a minimum quantity of 10. This year, you will need to pick one brand only for each age range. We don't have the funding to support ordering multiple brands. The CDC has notified us that COVID-19 vaccines will initially be shipped with shortened expiration dates. The shortened shelf life makes it more important than ever that you place smaller, more frequent orders to avoid waste. Moderna products will be dated for 3 to 6 months of shelf life, and dating may be shorter as the season progresses. For Pfizer, the refrigerated pre-filled syringes will arrive refrigerated with at least 12 weeks of shelf life. The blue cap vials will arrive at ultra cold temps and will have at least 3 months of storage if they continue to be stored at ultra cold temperatures. Dating may get shorter as the season progresses. For Sanofi or Novavax product will initially have a December 31st, 2025 expiration date, currently working with the FDA on a shelf life extension. Your order quantity should be limited to the amount of vaccine that you can utilize within a 4 to 6 week period for Pfizer and Moderna vaccines, or within a 2-week period for Sanofi Novavax vaccines. Also, it's more important than ever that you pay close attention to the beyond use dates and expiration dates on your COVID-19 vaccine stock. Vaccines should not be used after the beyond use date or the expiration date, whichever comes first. As I mentioned earlier, it is important that you do not use vaccine after the beyond use date or expiration date. Oh, says that twice, whichever comes first. All right, let's highlight the individual brands here. So we'll start with the Moderna Spikevax. This vaccine is available as a pre-filled syringe. It comes in a pediatric dose for 6 months to 11 years. That's the red label on the left. And an adolescent adult dose for ages 12 and up. That's the blue label on the right. This vaccine can be stored in a regular freezer until expiration. It can also be stored in the fridge with a beyond use date. When the vaccine is moved from a regular freezer to the refrigerator, it has up to a 60-day beyond use date that should be noted on the box. To avoid waste, store this vaccine in the freezer and then thaw doses in the fridge as needed. For Pfizer, the community pediatric vaccine is now the only vaccine that should be stored in an ultra cold unit. That's the blue cap vial for ages 5 to 12. It can be stored in an ultra cold unit up until expiration. It should not be stored in a regular freezer. This has been found occasionally during site visits, so please make sure that there are none being stored in a standard freezer. It can also be stored in a refrigerator with a beyond use date label for 10 weeks. To avoid waste with vials, store the vaccine in an ultra cold freezer and thaw the number of vials you'll use within 30 to 60 days in the fridge. Be sure to indicate the 10-week beyond use date as you transfer vaccine from the ultra cold freezer to the fridge. For Pfizer Comirnaty for ages 12 and up, it is the gray label here on the right. These pre-filled syringes can only be stored in the refrigerator until expiration. They cannot be frozen, and this is indicated by the pink "Do Not Freeze" label on the box. All Pfizer COVID-19 vaccines are direct shipped. The vials are shipped at ultra cold freezer temperatures with a temperature monitor. The box and temperature monitor need to be returned. The pre-filled syringes are shipped separately at fridge temperatures, and they do not ship with a temperature monitor in the box. Instead, look at the date and time on the packing slip that will either be inside or on the outside of the box. Novavax and Sanofi's Nuvaxovid comes in a pre-filled syringe and is the only non-mRNA product available. Since this vaccine is stored in the refrigerator until expiration, no beyond use date label is needed. If you have demand for a non-mRNA product, Nuvaxovid may be added to an order. Waste was 80% for this vaccine last year, so order approval will be selective. If you haven't demonstrated past usage of this product, your order may not be approved. All right, I've got one final knowledge check for you. True or false? Providers must select only one COVID-19 product to carry for each age range. That is true. You must select one COVID-19 product to carry for each age range this year. Good job. All right, here are the links to the tools and resources mentioned in this training. Also, this presentation was recorded, so we will post a link to it on the CVP training webpage by the end of next week. We'll also share it in our vaccine blurbs. Our next childhood vaccine program training will be on November 13th at noon. It looks like we'll be covering what to do in a power outage as we move into our winter months. If you have any suggestions for future topics, please feel free to send them to us at the email here. Before we move on to our question and answer, we want to remind you that a short 5-question survey will pop up as you exit Zoom. Please take a minute to give us some quick feedback on today's training. Now I think we could take a look at our Q&A.
Cheyenne, there were a couple questions that we marked to answer live. So the first one is, how long can Moderna Spikevax vaccine be stored in the freezer?
Do my storage and handling people have an answer for me on that one?
For Moderna, in the freezer
Yeah, how long can it be stored in the freezer?
up until expiration. And then
Okay.
then the shelf life will vary on what they're shipping at the moment.
And then kind of also related to Moderna Spikevax, does it have to be thawed before administering?
That is, yes, it does. And I don't know what it's more of a clinical question as to what the thaw time is on that, but you could send us an email and we could get you an answer for that.
I think also just adding to that, the only time you wouldn't be thawing it is if you already had the doses stored in the fridge, so they had already been thawed. But yeah, you should have
Yep.
to thaw them before you can actually administer it. I think that's all the questions we have that we wanted to cover live, but let's see. Oh, somebody responded to that the thaw time is listed on the Moderna page, so that would be a good resource if you have questions about how long it takes to thaw.
Awesome. Well, thank you so much for all of those questions. If you have any further questions that we didn't answer here, you can also feel free to send us an email at our WA childhoodvaccines@doh.wa.gov.